This is the heart and blood pressure tutorial.
I'm Cadence.
I'm Callie.
I'm Blake.
In this diagram of the heart, the blue drawing can represent deoxygenated blood, and the red represents oxygenated blood. Deoxygenated blood goes in through the superior vena cava, then goes through the tricuspid valve into the pulmonary arteries. This then moves it into the lungs. Does deoxygenated blood come in through the superior vena cava or the inferior vena cava? Correct. It enters through the superior vena cava. Oxygenated blood comes in through the lungs to the pulmonary veins. This then carries the oxygenated blood through the bicuspid valve, which is also known as the mitral valve. It is then carried to the aortic valve and carried to the rest of the body. What is bicuspid valve's other name? Correct, mitral valve. This is the superior vena cava. This is the right atrium. This is the tricuspid valve, the right ventricle. This is the inferior vena cava. This is the pulmonary valve. And this is the pulmonary artery. These are the pulmonary veins. This is the left atrium. This is the bicuspid valve, also known as mitral valve. This is the left ventricle. And this is the aortic valve. This is the aorta.
To determine what your heart rate is, you can use your index and middle finger and put light pressure on your neck. For 15 seconds, count how many beats you feel, then multiply that number by 4. I'll tell you your average beats per minute.
The normal resting heart rate for adults is between 60 and 100 beats per minute. When finding someone's blood pressure, you inflate a cuff that is wrapped around the person's arm right above the elbow. Make sure to inflate enough so then blood flow is blocked. Slowly turn the valve to release air. Watch slowly at the tiny needle to catch if jumping starts to occur. Systolic pressure is the number at the top. The typical number for this is 120. Diastolic pressure is the number at the bottom. The typical number for this is 80. So, in adults, the typical blood pressure is 120 over 80.
This is the heart dissection we did on a sheep's heart, with the red string representing oxygenated blood and the blue string representing deoxygenated blood.
The heart dissection.
Wait, this is the front. That's the back.
Yes.
Atrial septal defect is a heart defect that is characterized by an opening in the atrial septum, which is a wall that separates the two upper chambers of the heart, the atriums. This defect causes increased blood flow to the lungs.